how do you know that you need to prioritize? Well, the NCLEX will put a question, a scenario, that it will say something like this. You're going to receive an assignment for the nursing shift, and it's going to ask you, out of these clients, which client or which patient will you see first? Which patient has the highest priority? What medication will you administer first? Those are examples of questions that you need to prioritize. There are keywords that you need to know that will specify when the question is a prioritization question. Where can you find about these keywords? I will let you know in a few minutes. But let's see this simple question here. I'm going to give you 3 basic clients. Client 1, client 2, and client 3. Client 1 is a client who was admitted to the nursing unit during the night because of difficulty breathing. So let's highlight some important keywords here. Admitted during the night because of difficulty breathing. This tells me that there is an ABC compromise, which is physiological in nature. Client number 2, client on IV antibiotics and due to receive a dose at 0900 hours. And then client number 3, client is being discharged home today and needs further teaching about insulin administration and diet. So how do you prioritize in this scenario? It's very simple, but I wanted you to get the idea. So how do I prioritize here? Well, there is a very interesting strategy that is called the SAR method strategy. I've taught about that strategy multiple times in many of our videos here. You have to identify which patient is stable, unstable, which patient has an ABC compromise, which patient has an acute or chronic condition, which patient has a real or potential problem, which patient is stable or unstable or has a situation that the clinical manifestations are expected or unexpected for a specific medical diagnosis. This is the best strategy that you will be using on mostly your harder prioritization questions on the NCLEX. This will be the strategy to go to, okay? So using that strategy, we can say that if we look at the answers, client 1, 2, and 3, the most stable patient is patient number 3. Why? Because that patient will be discharged. So automatically we can eliminate 3. Now we're left with 1 and 2. Both of them have an acute condition. They're both admitted and they both need some kind of nursing action. See, client number 1 needs nursing intervention. Client number 2 has a medication due that needs to be administered. Now, out of these two clients, who has the priority? Well, let's think about this. Although a medication is due, we know that we have a time frame between 30 to 1 hour to administer a medication post-scheduled time. And at the same time, client number 1 has an ABC physiological problem. So therefore, if I have to decide between client 1 and 2, I can pick client 1 because of Maslow's hierarchy of needs. I will eliminate client 2. The correct answer would be client 1. So this is how we prioritize. Some of you may ask, Professor, but the patient was admitted during the night. So the difficulty breathing was at the time of admission. My question is, Does the patient still have a breathing problem? How do we know? We don't know. We have to go and assess the patient ourselves. And if the nurse that is going out and we're coming in tells us, hey, this patient was admitted with difficulty breathing, we need to follow up on that and confirm if the patient is stable or not stable. So a good question is, Professor, when is a medication the priority then? Oh, very good question. Let's say you have a patient that has a breathing problem or a hypotension problem or a bradycardia problem or a tachycardia problem, has an ABC compromise, and the medication that you will be administering, let's say an emergency medication, that needs to be administered stat because the patient has a physiological problem. So that would be a scenario where an administration of a medication will have the priority. Everything's going to depend on what answers you have available and the comparison between the answers. See, the thing with prioritization is that you cannot learn a table and say, well, this is the order of priorities. It depends on the scenario. It depends on the available answers. That's why you need to learn prioritization strategies in order to identify what patient you will see first.